In seeing some of this stuff, which I hadn't seen before, the watch, all that, how do we make sure, whatever we're doing, that we're not playing whack-a-mole, where we're doing it around something, it's vaping, and then all of a sudden it's back in another form, another way we never thought about it? Is it the nicotine content in any medium, or is there some way that we can not just deal with today's and yesterday's problem, but do it in a way where it doesn't pop up the next day in a different way that we never thought of?
It's a great question. And so there's a series of steps, none of them which are perfect, but I think several of which will guarantee you results. One is you need to ban all flavored e-cigarette products and the devices that deliver them, clearly without exception. I want to credit Massachusetts and New Jersey. They did a good job. Others have gotten there. There is model legislation to do it. Two, if you have the authority to do so, the reality is the crisis has also been fueled by the fact that these companies are delivering higher levels of nicotine. In the United States, the nicotine delivered is 3 times the legal limit of what is permitted in the European Union and the United Kingdom. There's a lot we don't know about the perfect level, but we do know that in the European Union and the UK, they're not seeing the youth crisis that we have seen. It's in part because they limit it to 20 milligrams of nicotine per milliliter. Juul has 59 milligrams per milliliter, and several of the products I've shown you here, all of which, by the way, are made in China, to reference back to your earlier comment, earlier session, has even higher levels of nicotine. So get rid of the flavors because they attract kids. Limit levels of nicotine if you can, so that those kids who experiment don't become heavily addicted and have no exceptions.
Thank you. Governor Baker, you've been extremely active. We'd love to hear lessons learned and any challenges you can share with the rest of us.
Well, first of all, it's funny how these jobs work. You get surprised. And on this whole issue with vaping, we just started to see some of the data that was coming out of the national CDC and the FDA about injuries and deaths associated with vaping. And then in last fall and early September, we started collecting it through our own Department of Public Health. And one of the things we learned was that nobody in the medical community ever asked anybody if they vaped when they showed up with a lung injury, because it never occurred to them that that might have been what caused it. Once they started asking, the numbers started to climb. And at the end of September, we had a bunch of people in, pulmonologists, pediatricians, researchers, and just said, tell us what you know. And the overwhelming message we got from all of them was that vaping, the fundamental act of vaping by itself, has risks because it's a liquid chemical compound that you are vaporizing, then pulling into your lungs, which are not built to deal with liquid in the first place, and then pushing it out. And there's a lot of evidence that in both the legal products and the black market products, there are microbial toxins in there that are just not good for your lungs. And the message they gave to me was, you need to do something now. And we talked a lot about what to do, and we eventually decided to put a temporary ban in place, 40 days, which was admittedly a big stroke of action. But honestly, I couldn't figure out any other way to get people's attention and at the same time create some urgency around doing something. And for my fellow governors, I guess what I would say is, there are a lot of people who are really unhappy with me when I did this, and I heard from them. But the thing you should know is parents, teachers, school nurses, almost anybody in the medical community would literally chase me down on the street or in a hallway or in a restaurant and give me a hug and thank me for what I was doing. The people who are closest to this know it's an enormous problem, and they were so glad that somebody was finally putting it in front of the public. And our legislature acted within 30 days of us executing the ban, and our legislation basically bans flavors, really restricts where you can purchase these products, period, to over 21 locations, and gives the Department of Public Health the ability to make sure we create what I would call sort of a public information campaign that lays out a lot of the issues associated with what some of the dangers associated with vaping are. But the most compelling comment I got from that first meeting with all those clinicians was a woman who was a cancer doc, and her husband was a pediatrician, and she said her kids believed that vaping was safe. And she's not safer, safe. And I think one of the greatest challenges we all have in this space is helping people understand that really easy to use nicotine products that deliver a pack and a half of nicotine in a cartridge probably aren't safe, in addition to some of the issues just associated with what we don't know yet about long-term use associated with vaping.
Thank you, Governor. Your leadership on this issue is critical. And it's the other reason to get rid of flavors is flavors are part of what makes a kid think it's safe. If it tastes sweet and goes down smoothly, how harmful can it be? You know, the Surgeon General in January issued a report. These are not safe. There's a lot we don't know, but what we do know is that inhaling high doses of nicotine, particularly with young lungs, is by nature harmful to the long-term health of their health. The other thing is these are perfect drug delivery devices. And no one should kid themselves either that if these devices are out there, kids are going to figure out what else goes in them, so that the crisis that we had last summer may or may not have been largely caused by other substances in it. But if you've got a device that delivers substances this well, you can be pretty well sure someone is going to figure out how to deliver it.
Thank you. Governor LaMonT, you've also been very active. Please tell us what you're doing in your home state of Connecticut.
Thank you, Governor Brown. Yeah, I thought cigarette addiction was maybe behind us 10 years ago, and now I see it's just being turbocharged by the vapes and the flavored vapes and Mr. Meyer's explanation of how much more powerful and addictive this is. I just follow on what Governor Baker said, where a lot of people think it's safe. I think we're sending a bit of a mixed message out there right now. You know, I'd love the FDA to be bold and clear in terms of what we can do and what we can't do and what is safe and what is unsafe. Some people think it's probably safer than cigarettes or gets you off of cigarettes. There's some mixed messaging out there. And one of the things I'm trying to do, because I come from a small state, is work with Charlie and work with Governor Cuomo and work with Tom Wolf and work with some of our neighboring states, see what we can do on a regional basis. Because what I can try and outlaw or set for one small state doesn't make as much sense if all you got to do is drive 30 miles across the border to take care of that. So we'll take the lead, as Mr. Meyer said. You know, there's yin and yang between what states the laboratory of democracy and the feds, and we're going to take the lead, and hopefully the feds keep following and send a clear message for us.
I think that's terrific, and there is a real opportunity with Massachusetts having acted, with Rhode Island with having an emergency rule in place that hopefully will become permanent, hopefully with Connecticut. New York City recently banned these, and under Governor Cuomo's leadership, New York State has legislation pending to do so.
Didn't New Jersey do it too?
New Jersey has already done it. Second week of January of this year, New Jersey did it, and legislation has been introduced in Maryland, Delaware, and the District of Columbia, so that we have the potential to have real change and be able to see the impact of it. And hopefully that's only the beginning. And
in the end, as Governor LaMonT said, I think we would all hope that the FDA would come around so that we have a national solution to this, and we would hope that they would do it in a way that's consistent with the underlying premise for the design of regulation, which should be test the product first before you put it into the marketplace and try it out on our kids, just as we do with pharmaceuticals or medical devices.
Governor Bullock.
Yeah, we know in Montana about 30% of our high school students are regularly using vape, 16% of our middle school students. But I think that we could easily get sort of blinded by statistics. I'd encourage any of you to call a school resource officer or a principal, find out what's actually happening in those schools. I decided I couldn't wait until the legislature, so I did an emergency rule, and I thank Matt for providing an expert, because it was also then immediately challenged in district court. We didn't make it about government versus business. We made it about pediatricians and kids. And one of the lines from that opinion was, despite statements from officials at the federal level that some regulatory action would be taken to address the youth nicotine crisis, none has occurred. The mere existence of flavored vape liquid in the market creates the immediate peril to youth, and no other administrative act could remove it from the hands of youth. So if anyone wants to see both the rule and the district court opinion, because it has great language about the risks and why we as governors need to take action, to reach out, and I'd be more than happy to get it to you.
Thank you, Governor Bullock. Any comments from our panel? Any other governors? Questions, comments? Well, I want to say thank you to our extraordinary panelists for joining us this afternoon, for their passion and determination. Really appreciate their participation. Want to say thanks to all of you for joining us this afternoon.